the renal dialysis unit, we call the RDU of the Kolebu Teaching Hospital, has been offering dialysis for patients with renal failure over 2 decades ago. However, it has lately been bedeviled with some operational challenges, which resulted in the temporary closure to outpatients. Mr. Speaker, the RDU currently operates from 2 main locations in the hospital and provides both inpatient and outpatient services to patients at the hospital. 1, the medical blood dialysis unit, which has a capacity of 22 machines, but currently operates with 1 being used to dialyze hepatitis B positive patients. There are challenges with the water treatment system, and the machine itself needs to be repaired at least twice a week. Mr. Speaker, the satellite unit, called the cabin, currently has 10 functional Fresenius 5008S hemodialysis machines. This is currently the main center for inpatient emergency cases and for outpatient dialysis as well. Mr. Speaker, on the average, the unit caters for between 260 to 300 patients, and at full capacity undertakes about 2,000 dialysis sessions per month, operating 24 hours. The facility has never had the occasion to turn away any patient. Mr. Speaker, the Kolebu Teaching Hospital has had a 10-year contract with Fresenius Medical Care South Africa Limited, FMC, to provide dialysis machines and consumables to the hospital. Over the 10-year period, the company is to provide Kolebu with a total of 60 hemodialysis machines of 2 different specifications, other ancillary equipment and technical equipment for servicing of equipment. Mr. Speaker, it must be noted that FMC is a global leader in the provision of dialysis equipment and high-quality consumables. It is important to use products of the highest quality to minimize complications to our vulnerable patients. Kolebu, in return, is obliged to pay for hemodialysis consumables worth a total of €11,865,000 over the 10-year period for the equipment and services supplied by FMC. The main revenue stream for the RDU has been proceeds from the payments of hemodialysis sessions. Currently, every patient is on the subsidized rate of 380 cedis per session. So, Speaker, over the past 5 years, a company in Ghana we call the First Sky Group of Companies has graciously committed to paying 1 million Ghana cedis every quarter to enable patients who cannot afford life-saving maintenance hemodialysis to have 2 sessions of dialysis a week for free. Currently, there are 230 patients on the free dialysis program. This is the ceiling on total number of beneficiaries specified by First Sky Group of Companies. This constitutes over 80% of the patients receiving treatment at the renal unit and accounts for over 80% of the renal unit's revenue. Mr. Speaker, for the past 2 years, the payment schedule initially agreed on with First Sky Group of Companies has been fraught with delays. Due to these delays, the RDU continues to accrue exchange rate losses, which has made it difficult for the RDU to service the monthly payment to the partner. Mr. Speaker, let me use this opportunity to thank once again the First Sky Group of Companies for this massive philanthropic gesture, which has supported Kolebu and patients for the last 6 years. Mr. Speaker, in view of these challenges, Kolebu has accrued a total debt of a little over 4 million Ghana cedis to its partner. Furthermore, it remains a fact that the current charge of 380 cedis for dialysis is insufficient to enable the RDU generate enough revenue to fulfill its full obligations under the contract with FMC, especially as it does not have a hedged exchange rate per annum regime. This has compromised the ability of the RDU to raise the funds required to pay for consumables procured from FMC promptly. Mr. Speaker, again, due to the high incidence of patients requiring dialysis, the total cost of care keeps rising, adding to the accumulation of debt. Mr. Speaker, it must be noted that currently, patients on dialysis are not on the National Health Insurance Scheme. Mr. Speaker, the Nkommo Wo Teaching Hospital, in consultation with the Minister of Health, has initiated discussions with FMC for review of the current contract for more flexible payment options and a more structured supply of consumables to avoid excessive delays and to ensure delivery of the outstanding 45 dialysis machines and auxiliary equipment to boost the service being rendered. Mr. Speaker, in the meantime, the RDU has been opened to the public since Monday, 6 November 2023, to add patients as directed by the ministry. The MOH has since made a request to the Ministry of Finance to settle the total indebtedness of the 4 million Ghana cedis. And the good news now is that the Minister for Finance has just approved the disbursement of this 4 million to support our patients in Nkommo Wo. Way forward. To forestall the recurrence of this unfortunate situation, the Ministry, in collaboration with Nkommo Wo and the Minister of Finance, is considering one of the following options: the possible inclusion of dialysis on the National Health Insurance Benefit Package, the granting of subsidies based on proposal received from Nkommo Wo, and the possible review of the tariffs to ensure sustainability of the services. And Mr. Speaker, it may interest you to note that the private health facilities charge between 800 and 1,300 Ghana cedis for just a session of dialysis. The decision on the options enumerated above, Mr. Speaker, will be announced as soon as practicable. Mr. Speaker, as part of our non-communicable diseases roadmap, the Ministry and its agencies will continue to raise awareness for prevention and early detection to reduce renal disease and minimize the burden on the renal units in the health sector. When this is realized, the total cost of care and the need for dialysis will be brought to the barest minimum. Mr. Speaker, government has invested, with the support of Parliament, by approving facilities for us in the construction of a 100-bed ultramodern urology and nephrology center of excellence at the Nkommo Wo Teaching Hospital, which will be commissioned by the end of the first quarter next year, 2024. This is aimed at facilitating the provision of kidney transplantation services, among others. Mr. Speaker, this will further reduce the dialysis burden on the nation and the need for Ghanaians to travel abroad for these services. A local team has been trained to provide these services, transplantation services, at reduced cost, and have already undertaken the first few kidney transplantations successfully in country by our Ghanaian doctors. Mr. Speaker, I believe this is the beginning of the government's vision of making Ghana a hub for medical tourism.